Hello, this is Laura Paxton, here to talk to you about occupational therapy for adults. This is actually step 4 of the new Borderline and Beyond program. Step 4 actually reads, how to make choices through learning sensory modulation skills. And what I write about in this chapter is how if you don't have a solid sensory neurological base, then you cannot develop an emotional base to modulate your feelings. The psychological is built upon the neurological system. Occupational therapy is designed to address every aspect of one's life, not just occupation as in work. When most people think of occupational therapy, they think about therapy for children. Increasingly, adults have been seeking out occupational therapy. Mostly it's people newly diagnosed with Asperger's syndrome as adults who realize the importance of such a practice. People with borderline personality disorder, or that are diagnosed with it, need to recognize that this is something they might want to try. It does require a doctor's order. You would need to call an occupational therapy clinic and ask for the paperwork to be sent to you. Take it to your doctor and see if they'll sign. If you need assistance with this, you can bring them on this guide, because it points out more than one research study that backs up how effective occupational therapy can be for you. Holding my own book upside down. Okay, so nobody's perfect. Karen Moore used the Wilbarger brushing protocol in her study that she did with borderline personality and decreasing self-mutilation. What this does is it decreases your tactile defensiveness. And what that means is it makes you less sensitive to touch or hypersensitivity to touch. It calms that down. It also just fine-tunes and will refocus your nervous system in a new way. So this is a Wilbarger protocol brush. Originally, only surgical brushes were used, and then it was discovered that a corn brush, such as this one, is incredibly similar to a surgical brush and much cheaper. And this is a long handled brush that can be used by people who don't have someone to scratch their back. You essentially awaken the nerve endings in your arms, legs, and back, and then you use a series of proprioceptive exercises to put your nervous system back together after the stimulation. People are not aware that there are 2 senses beyond the basic 5 senses. We've talked about the tactile stimulation. This is your sense of touch. There's also, of course, the sense of smell, the sense of taste, hearing, and sight. The 2 extra systems are the proprioceptive and the vestibular systems. The proprioceptive system essentially makes you aware of your body. For example, if you're sliding down a slide as a child and you hit the bottom, you feel your body right in that moment. That's one reason sliding down a slide is so much fun. Now, proprioceptive exercises will help you really sense your body in a strong way. And it makes you feel tight and together after you've really stimulated your body. The technique has an intensive for about 2 weeks. It must be done under the guidance of a licensed occupational therapist. It is dangerous to practice it otherwise. You really need the guidance of an OT. And it's also a technique that is copyrighted, and so you really don't want to use that technique without having some supervision. It's copyrighted by Patricia Wilbarger. Okay, so the next system is your vestibular, and this is a vestibular disc, and this is something I got from my occupational therapist. Okay? The purpose is to balance on the incredibly important, especially to people who have Asperger's syndrome, because dyspraxia, it often goes along with it. And learning new balance skills can really go a long way toward making a person feel whole and integrated. If a person's diagnosed with borderline personality, quite honestly, their symptoms are so similar in many ways that oftentimes people diagnosed with BPD are also dyspraxic. So the balance portion is important to address for quite a lot of people with either diagnosis. In addition to this, sensory diet is employed, which will help you to understand better what you need at any given time, whether you need something to soothe you, something to stimulate you at any given time, chomping on chips when you're nervous, or an apple. Going for a ride in a swing is wonderful for both proprioceptive and vestibular input, and so is jumping on a trampoline. These are just a few examples of the things that you can do that are part of what's called the sensory diet. In my book and in my workbook, I explain in detail how to develop your own sensory diet program and how to experiment with it so that it works. The logbook portion will actually allow a person to record what they're trying that's working and what they're trying that's not. This is the case with the whole program to begin with when you're learning emotional modulation skills, but I added an entire section to specifically help with learning about how to develop a sensory diet. And it's just like planning any other menu. You try some foods, some you like, some you don't like, some you burn on the stove, some are easy to prepare, and then you finally find the diet that works for you. And once you have sensory modulation down, emotional modulation is not that difficult. Listening therapy is also used. This is a headset that's used. This cord goes in the left ear. Specialized CDs are used to help with the vestibular system within the inner ear. It's just amazing what you can get when you go to occupational therapy. I had 6 months once a week, and it was absolutely one of the best experiences of my life. I learned about it through this book, and it's Too Loud, Too Bright, Too Fast, Too Tight by Sharon Heller, PhD. And after reading this book and getting my doctor's order and going through the exercises and doing intensive research about how it works with research with how this program can work with a variety of conditions, I put together the new expanded Borderline and Beyond program. And I'm really pleased to bring this to you because it's not only based on my research but on my personal experience. And I'm also just really happy to bring to you a basic introduction about how occupational therapy can be used with adults. Thank you very much.